For our neck cars, we're going to be taking our neck through its full rotational range of motion. So to start, we'll start off with our full body tension. We want everything nice and tight. We're going to align our neck, keeping our crown nice and tall so we're not jutting the neck forward. So we have our head almost like we're in that double chin position. You can take a C grip and just kind of push your head back just to make sure that you're nice and tall and aligned. Bring chin down to chest, keeping that nice alignment of the spine, chin to chest, feeling the front of your neck squeeze. So bringing the neck down into flexion as far as we can without anything else getting involved. Once you've maxed out that neck flexion, we're going to start rotating. Rotate down along the collarbone until you can't rotate any further without compensating in some way. Once you've maxed that out, we'll just change the axis, continue rotating like you're looking over your shoulder. Once that rotation's maxed out, you'll feel the side of your neck. So squeeze those tissues there, and then we'll start getting a lateral bend. So we're holding that rotation, giving it a lateral bend, and then bringing our neck back into extension. Hold that extension as you rotate over to the other side. And you have that lateral bend on the other side. Once you've maxed out that range, we'll look over the shoulder again, down along the collarbone. And you can either pass through, I'll demo a pass through here. Again, along the collarbone, max out that rotation, change the axis, look over the shoulder, dip back, and around to the other side. Over the shoulder, down, and then we can reverse. Along the collarbone the other way, looking over the shoulder, dipping the head back, around, through that full range of motion, down, and bring it back up. For our spine cars, we're bringing mainly our T-spine through its full range of motion. So we'll bring it into flexion, we'll bring it into extension, and we'll bring it into rotation and lateral bend. We're going to combine all of those directions of movement with one singular controlled articular rotation through that full range. So I like to start off with arms across the chest. We're going to round forward into flexion. We're going to max out spine flexion there. So I'm rounding that spine as much as I can forward into flexion. Once I've maxed out that flexion, I'm going to hold flexion. So squeezing all these front side tissues, hold that flexion, and begin rotation, keeping the hips facing forward. So I'm not rotating at the hips, just getting as much spine movement as I can without anything else getting involved. Once I've maxed out that flexion with rotation, I'll lateral bend over to the side before moving to extension. For extension, I'm holding that rotation and then arching my back, arching as much of my spine as I can without driving the hips forward. So I'm holding extension and rotation. And then I start to slowly rotate through to the other side while maintaining spine extension. Rotate to that other side. Maxed out extension with rotation. Once I've maxed out there, I'm going to lateral bend. Once I've maxed out that lateral bend, I'm still holding that rotation. Rotation with flexion. To middle, I can either pass through or for another repetition or reverse. I'll just reverse here. So flexion, rotation the other way, lateral bend, rotation and extension. Hold extension as I rotate over to that other side. Lateral bend, rotation with flexion, middle, and slowly rolling it up. For your Scapula CARs, we're going to be moving our shoulder blades through their full ranges of motion. The main motions for your shoulder blade are going to be protraction, which is bringing them forward, retraction, squeezing them together in the back, elevation, and depression. Those are kind of the four cardinal movements of your scapula, and then they also tilt as you're kind of combining those movements. So taking our scapula through their full range of motion, I'll start off with scapula depression. So I'm bringing them down and then into depression with protraction. So down and forward, protraction with elevation. That's forward and up. Then we'll go up and back, back and down. You can pass through for another repetition, nice and slow, getting max range. In the front, you really want to feel those shoulder blades coming around that rib cage, forward and up and back, back and down. Couple points you want to be aware of is as you're moving back, when we don't want to get assistance in that movement from the arms. We want scapula only. A lot of times what I'll see is the arms bending and coming back to help. We only want scapula to work there. And then also the tilting of the rib cage. Keep your rib cage down, parallel, ribs parallel with the pelvis as you're doing the movement. Notice my arms stay right at my side through that entire movement, and it's the scapula that are moving there. For your shoulder CAR, you're going to be taking the shoulder through its full rotational range of motion. We're going to be including shoulder external rotation, right? Shoulder moving, opening out away from the body. Shoulder internal rotation, adduction, abduction, flexion, and extension. To start, I'm going to hold my body nice and still, full body tension, holding everything else still except for my shoulder joint. I want my shoulder joint performing all the movement, getting as much range as I can without anything else chiming in to help. So I'm going to start off by externally rotating my shoulder. External rotation on the front half. So I'm just twisting and opening up the whole time I'm on the front side. So external rotation through the front as I come through adduction as much as I can, making sure to keep that arm straight. Moving up through shoulder flexion and getting as much flexion as I can without arching my rib cage, without pushing my pelvis forward, just getting as much pure shoulder flexion as I can. Once I max that out on the front side, I'm going to twist for internal rotation. Internal rotation the whole way back. So I'm twisting in that whole way back as I'm reaching into extension, trying to keep my arm up as high as I can. I'm not just letting it drop. Nice and high, using rear delt to control that. More internal rotation now as I'm coming back into extension, around and down. I'm fully internally rotated at the bottom. So the top of my hand is now facing my side. And then I reverse that motion using rear delt to lift into extension. Once I've maxed that out without compensating, I start externally rotating, going as wide as I can without compensation, coming up, back around to flexion, adduction, across, and down. For your elbow CARs, we're taking our elbows through their full range of motion. As we all know, elbows flex and they extend. What may not be as commonly known is that elbows also rotate, right? So they supinate and they pronate. So we want to work that flexion and extension as well as that supination and pronation. So for that, you could do one or two arms. For this demo, I'll be doing two arms. Lock your elbows, pin your arms right to your sides. Total body tension. And to start, we're going to start with supination. So we're twisting up on the way up. I'm turning my hands up and out as I come up to the top, all the way to the top. Don't stop short. Make sure you come all the way to the top. Get that full range of motion. Turn over and pronate as you go down. Supinate on the way up. Over, pronate on the way down. After completing a couple repetitions there, you're going to reverse that motion. So we're going to be now pronating on the way up. So I'm twisting down and out on the way up, all the way up to the top. Supinating on the way down. All the way, full extension. Pronate on the way up. Over, supinate on the way down. Try to feel that motion as high on that lower arm as you can, right by that elbow. Don't twist too much at the wrist, and definitely don't let the elbows flare out to the side. So keep that motion right there in the elbow. Wrist CARs. We're going to be taking the wrist through its full rotational range of motion. Wrists move in all directions, so we're just taking it in a big circle. The things that you want to be aware of is making sure to keep that arm pinned to your side. I like to just do this exercise with the arm kind of locked at 90. I bring my hand, my palm back towards me without bending my arm. So just bringing that palm back towards me into flexion. And we're going to come into the pinky side while holding flexion as much as I can. Working that forearm, coming into the side. And then moving into wrist extension. Notice I'm not turning my hand over to bring it down. I'm keeping my palm up, my wrist up the whole time as I come into that extension, pulling the top side or back side of my forearm here back as I'm coming into that extension, holding extension as I go to thumb side, up and around, back into flexion, and then I'll reverse. Couple things you want to be aware of is not rotating over. This isn't the elbow CAR, this is the wrist. So you want everything going from the wrist. Also, as much as you can as you move into that flexion, try not to mutate that hand as you pull in or as you go out. Try to keep that hand as straight as you can the whole time. Again, we're trying to isolate that movement through the wrist without anything else chiming in to help. For your hip CAR, we're going to be taking our hips through their full rotational range of motion. In the front half, we're going to be externally rotating, flexing, and abducting the hip. For the backside, we'll be abducting, internally rotating, and extending the hip. We'll start, as always, by getting full body tension, everything nice and tight. We want to maximize our hip range of motion without compensating and using anything else. So nice and tight. And then externally rotate. Then start bringing my hip into flexion while still holding that external rotation the whole time. Once I've maxed out that hip flexion, we'll hold it high, maintaining flexion while abducting the hip. Once I've maxed out that abduction, internally rotate as much as I can without losing any of that hip flexion or abduction. So I'm up here, squeeze out any internal rotation that I can get. Maintain that as I push back into extension, around and down, knees meet. That's half of the motion there. I push back into extension, using that glute to pull that hip back. Once I max out extension without extending my spine, only hip extension, I'll abduct again, start to externally rotate, and then reclaim that hip flexion, external rotation, coming up, around, and finishing off, coming back down. For our knee CARs, we're going to take our knees through their full rotational range of motion. Don't worry if you can't make it down to the floor. This can be done from a chair, but here is the general motion. You can even do these from standing. First thing that you want to do is just make sure that your knee is rotating. So if you put your hand right at the base of your kneecap, you'll be able to feel your shin bone rotating under that finger. So that's the first thing that you should be able to feel. You'll see a lot of ankle movement, but I want the knee rotating. Once you've established that the knee can rotate, we'll move our knee through leg extension and leg flexion along with that rotation. To set up, if you're seated like this, you'll just want to stabilize that upper leg. If you're seated in a chair, you can just put your arms around it. Seated here, I like to scoop that outside arm underneath and then just lock it in here. I externally rotate that knee. So I'm turning out. This first part of the movement, I'm kicking, twisting out, maintaining that outward tension the full time as I kick up. Once I reach the top without locking out, because if I lock it out, the knee is not meant to rotate with a locked out leg. My whole leg will rotate. So just before lockout, I stop, I'll turn in and bring it back down. I'm twisting in the whole time. Turn out, twist out the whole time as you kick up, twist in and down. After a couple repetitions, you just reverse directions, twisting in the whole time as you kick up, turn out the whole time as you pull back down. In, kick up, twist out and down, or twist out, kick up, twist in and down. And you can just kind of oscillate between those two movements. For your ankle car, these can be done on the floor. They can be done standing and seated. The main thing is that the motion is only coming from your ankle. We're going to move our ankle through its primary ranges of motion and combine all of those into one circular movement. Remember, we're trying to get ankle dorsiflexion, which is pulling those toes back towards the shins or up towards your head if you're standing. Pointing, plantar flexion. Ankle inversion, which is bending inward. And eversion, which is twisting outward. So you have those 4 cardinal points. Combine them all into one motion. So start off with dorsiflexion and then eversion. I'm twisting my foot out, holding as much as I can as I hold, as I move to plantar flexion from eversion to plantar flexion, full plantar flexion to inversion, pulling back to dorsiflexion. Big circle. And what you'll want to do here is keep that motion nice and slow. Oftentimes I'll see the ankle wanting to be jumpy and people will skip through the places they don't have control. If you feel like you're skipping through, that's your clue to move slower and really try to mentally control that zone. Don't worry if you can't control it right away. As you build your practice, you will gain more control. As long as you train that ankle to move, or any of the joints for that matter, without kind of allowing yourself to compensate. The more you train to compensate, the better you will get at moving with compensation. The more you train to move without compensation, the better you will move without compensation. Our last and definitely not least important movement in this series is the spinal segmentation cat-cow. I know that's a mouthful, but all it is we're segmentally moving through our cat-cow motion. Most of you know our standard cat-cow, we're just kind of moving into an arch, moving into a rounded back. Without focused effort on spinal segmentation, our back will only move where it currently is good at moving. When we work on the spinal segmentation, we start building competence in and control of moving the spine in all of its different segments. So for this movement, we can start off from full flexion. We also want that posterior pelvic tilt. So we're tucking that tailbone under, rounding that whole spine, making a nice C shape with the body here. And also with our C spine. So our head and neck is even in flexion as well. We're going to start off from the bottom at the pelvis, moving into extension. So anterior pelvic tilt. I'm arching that low back and pelvis. Starting to slowly, one vertebrae at a time, moving from flexion to extension. I move through mid back. I move through upper back. And then finally, get my C spine into extension as well. My whole back is now in extension. Notice I'm not bending at the elbows or compensating anywhere else. I'm trying to just get as much direct control of my spine as possible. Now I'm in extension and I'll move back to flexion. So from the bottom again, pelvis, posterior tilt. I'm tucking that tailbone under, starting to round lumbar spine, moving through T-spine, all the way up, moving back into flexion. And then finally, neck and head come back into flexion.